Okay, but before we start though, how many of you all had been to a chiropractor before coming here? You'd been, but you never have?
No.
Okay. Were you excited about coming here tonight? No. I mean, no one is excited about coming, you know, but the thing, when you leave, I hope that we can give you a couple things that you're going to think about. Because most time people think about chiropractors is neck pain, back pain, headaches, that kind of stuff. And you don't come until it's like really hurting, but missing really the benefits of what chiropractic can really do. The main objective tonight for this class is to teach you how to utilize all your little toys, okay? Because those are really important. And you can have them, like some of my patients will get them, and we used to just hand them to you and say, you know, this is what you need to do. But they would go home and it would sit in the closet. And then I'd say, you know, did you get the stick? You know, and they, yeah, I got it. And I didn't ask them if they were using it. You know, it's important to use these things, okay? So if you're feeling like, you know, I don't really know what I'm doing, we keep them in here so you can practice with them. And, you know, the main thing I want you to get out of this is, well, we're going to try to teach you something about health, okay? Because chiropractic is part of the health pie. But you're probably going to hear some things tonight you're going to go, I didn't know that. You know, the most important thing that you have in your body that's running right now is what? Shout something out to you.
Oxygen.
Oxygen, okay. So your lungs.
Your brain.
Your brain, okay. Most everybody says the heart, okay. Which, you know, all of them, if they quit, you're in trouble.
Yeah.
But the brain is really important. You can't do anything without the brain telling it what to do. And so we're going to kind of open up this class quite a bit today because I want you to understand chiropractors aren't just working on your neck and your back. We're actually working on your brain. And I know it seems kind of funny, but you're going to see how it really does work on your nervous system. And that's why we assess people from the feet up. Because if your brain and your nervous system is working properly, you express health in a great way. I mean, you reach your potential. And the difference between having really good health as you age and poor health as you age comes down to a lot in posture. Okay? Now I know Dr. Brian, when he did your exam, he showed you the pictures, and this is not a before and after picture. I kind of wish it was, but it's just two ladies who are 83 years old. And so our class is built around this. What are you doing on a regular basis that you're thinking about that you can get to 83 and still be healthy? Nobody thinks that way. Okay, what we think about is, oh, I got a problem, we got to go take care of it. You know, so we're always behind the eight ball. You're never really being proactive. So I'm going to get you to think tonight a little bit about that. Because these two patients have two different health pictures. We all want to be like the lady over here because her posture looks good. This takes work, okay? We don't want to end up like this. Now, I mean, this is a nice lady, okay? So we're going to talk a little bit about the two of them. But I wanted you to kind of get at least the groundwork that I'm going to teach you about how to use those so that you can basically, as you age, your spine's going to age well. All right? If you don't take care of it, it's like anything. You know, it's kind of funny, but some people come in and say, you know, I don't want to go to a chiropractor because I hear once you go, you got to go the rest of your life. And I go, yeah, you ever say that to your dentist? Try that one on your hairstylist. You got one shot, fix my hair and I'm never coming back. There's nothing that you do in life that you don't have to maintain. But people think, you know, chiropractic is just about pain. It's not. You're going to see that it's much, much different. But I want to give you a few statistics to think about. If you are not doing something to take care of your health on a regular basis, you're going to become a statistic. And this is what's going to happen this year, 2015, that's coming up. 332,000 hips will need to be replaced. Okay? 719,000 knees will have to be replaced. And we have a nice picture in here to kind of demonstrate that on a graphic level here. You've got, this is before and after. I'm not very fancy, but you can see this is one of our doctor friends that had a patient who came in. Cross-country runner, really good cross-country runner, I believe was 17 years old, was wanting to run in college, very good runner. But the mother wanted the child to be seen because back pain. Now, your eyes are going to see the shorts look crooked, don't they? Okay? So a chiropractor takes a look at this and sees, wow, it's unbalanced. You know, and the kid was running and was starting to have back pain. You know, that's what was bothering him. But our eyeballs went to that knee, like yours probably did. That looks funny, doesn't it? And that ankle to us looks funny. But wasn't experiencing any ankle or knee pain, it was just the back that was bothering him. But, you know, the runner got his feet scanned. That's why we start with you guys right away with a foot scan, because you're standing on top of these guys, and if they're crooked, well, everything else is going to be crooked. So, you know, for us to spend time just working up in here is really a fruitless, you know, operation. And, you know, a lot of chiropractors just work on the spine and don't even look at this, but we work on the feet all the way up. It's very important so that you maintain your proper alignment. And you're going to see that if your alignment is working great, your nervous system works great. And if your brain's working good, you experience health. So it really goes hand in hand. So anyway, long story short, scan the feet, put the orthotics in just like you guys got in your shoes, and this is the after picture. Same day, okay? That is a knee replacement waiting to happen. The statistic, okay? Wasn't hurting. You know, do we wait till it hurts? A 17-year-old put 20 years of abnormal wear and tear in that knee. What's going to happen? It's going to wear out. 37. So, you know, this is excellent, you know, that the chiropractor took care of the back pain, but prevented this kid from wearing a knee out. That's why I give that statistic. 332,000 knee operations start out like this. And then all of a sudden, I don't know why it's happening. And a lot of doctors will say, you know, when it ends up being 60, 65 years old, and you say, well, why, Doc, why didn't my knee wear out? I say, well, it's old age. And I always tell them, go back to your doctor and say, you know, well, my left knee is just as old as my right knee. How come that one doesn't have old age? It's because of this, okay? Now, there are other knee pathologies that could cause a problem, but this is the majority of it, okay? And so when we checked you all out to straighten your spines out and give you good posture, we're really wanting to do that not just so you feel better, but so your nervous system will work right. Because look at this. That muscle right there is not working. It's working here. So the nerves that were being torqued, had pressure on them, wasn't sending out the signal to make that muscle work. So it was flaccid. You go ahead and align the feet, and all of a sudden the nervous system's lined back up, it starts working again. So it gets you kind of thinking. I had this put into a poster because of that. This wasn't one of my patients, but this is an autopsy photo of a man who died of kidney failure. Okay, so they did an autopsy to see what took place. When they got away down to the bones, we could see this is a lower back. There's 5 bones in the lower back, but you can see the vertebrae, you can see the disc. That's a healthy disc, healthy disc. Oh, that doesn't look good, does it? And then you got a healthy disc. Good nerve, ooh, what's wrong with that? Now, they're not this color. It's all gray, pretty much. This is gray, the nerves are gray. I wish they hadn't colored them. But you can see thick nerve, that one's shriveled up. Guess where that nerve went? To the kidneys. Isn't it amazing? Bad disc compression on that causes the nerve to get pinched, and then you have right in here, and you guys don't read x-rays or look at bones, but that's a degenerative facet joint, which we would, in doctor terms, would say, oh, you got arthritis in your back. So in his history, would you be surprised, he had facet joint injections, steroid injections, he had injections into the muscle tissue, taking painkillers, anti-inflammatories, muscle relaxers. It's not fixing this, okay? Literally, and I'm not like trying to exaggerate this, but if this person had gone to a chiropractor, taken an x-ray and seen, wow, you're really having trouble with this, could have saved his kidney. Because you go ahead and restore normal function in there and take some pressure off of this, the nerve starts working better. It's no wonder why in our office that we hear people who are on you know, antacids all the time because they don't digest food right. We've had countless ladies who couldn't get pregnant because the ovaries weren't working right. We had one lady who spent like $60,000 trying to get pregnant, and you know, she didn't come to us for that reason, just had back pain. So we assessed everything, found some stuff in her back like that. We did some treatments on her, put her in the orthotics. She was doing great, and within 2 weeks she was pregnant. And she came in, you know, the doctor's like, oh, it's a miracle. But that's happened hundreds of times in here, and we wonder how much of it is the nervous system not telling the organ to work properly because we have bad posture. Because, you know, we got something that's crooked, something's not working right. It just makes sense, it's common sense. But medicine and common sense don't go together. So what we want you to get from this little class is learn how to take care of your own spines so you can age well, keep your spine in proper alignment so it can move right, function right, so that your brain and your nervous system can do what it does best. You know, you don't have to think about it when you cut yourself to make a scab. Your brain goes, oh, there's a problem, let's do this, there's all these little steps, and it takes care of itself. But if there's nerve blockages somewhere, it doesn't do it very good, okay? So that's kind of the premise of all this, and also just to give you this mental picture a little bit more about your brain. Your brain, whatever it thinks, it's true, okay? You know how sometimes when you have a dream and you wake up and you go, man, that was real, but it wasn't. Your brain thought it was. This was probably the most exciting story I read, and it was about, I think it was in the 1980s, and I lost the paper, so I don't have all the facts anymore, but the story kind of went like this. It was some kind of commuter flight was flying over the water, somewhere way off the coast, and there was a crash in the water. Everybody died except for 3 guys. And they were able to pull together some of the wreckage and make a raft. And it was pretty good size. It was about the size of this room. Anyway, they were out to sea for some terrible amount of time. I want to say it was like a couple months. You know, just bobbing around out there. And of course, you know, they did get rescued.